Namaskar. I am Dr. Agnik Pal, Associate Professor, Santiniketan Medical College and Consultant Cardiodiabetologist. Today, I will discuss some tidbits about the hypertension and how to prevent or control it. So, hypertension is increased blood pressure. Blood pressure is basically the pressure by which the blood exerts force on the arterial wall. So blood pressure is basically measured by sphygmomanometer. It is an instrument by which there will be two readings can we got. One is systolic blood pressure that basically measures the amount of the pressure that is created by the blood on the arteries when the heart is contracting. And another is the diastolic blood pressure, which is the pressure exerted on the blood vessels wall when the heart is resting, that is in the diastolic phase. So basically this systolic and diastolic blood pressure is given in a ratio, and by which we can assume what the pressure is according to the sphygmomanometer reading. So hypertension is basically when this blood pressure is greater than 140 millimeter of mercury systolic and greater than 90 millimeter of mercury diastolic. And the normal blood pressure is 120 by 80, and after the 140 by 90 is got on 3 or more multiple times, then we have to stamp it as hypertension and we have to treat it. Now this hypertension most commonly in 90 to 95% of cases are known as the essential hypertension or primary arterial hypertension, where there is no exact cause, but it may occur due to the conglomeration of different types of the genetic and ecological factors, and of course different types of the lifestyle issues. And in rest 5% of the cases, hypertension occurs due to some other diseases. That's why it is known as the secondary hypertension. Most common cause of the secondary hypertension are different types of the renal diseases, like renal vascular hypertension, primary hyperaldosteronism, and different other endocrine conditions. Most commonly, we are seeing the primary or essential hypertension, and when the hypertension occurs, or if we have to prevent the hypertension, first we have to modify our lifestyle problems. For example, most of the cases we are just following the sedentary lifestyle. That is, we are not doing any physical exercise, we are not walking, we are not running, we are just doing our works, just sitting in a laptop or sitting in a corner of the home. This sedentary lifestyle ultimately takes a toll and increases the obesity. The body mass index is increased, the central obesity is increased, and ultimately all leads to more chances of the development of the hypertension. So we have to do physical activity, we have to do the exercise. The exercise can be aerobic and anaerobic exercise. Most commonly, we have to start with the aerobic exercise, that is the bricks walking, running, etc. And it should be supplemented with some strengthening exercises. Like, for example, the easiest way is to take two 500 milliliter water bottles in our two hands, and then we have to do it up and down. This is the simplest one, and there are several other strengthening exercises. The guideline says that we should do approximately 150 minutes of the aerobic activity that should be spread upon in 1 week. So this can be done, and associated with we should also do some strengthening exercises or stretching exercises, etc. So this is about the physical activity. Next important thing is of course the diet. So to stop hypertension, we have to follow a proper diet. For example, we have to take the carbohydrate, proteins, and fats in a balanced way, and we have to take the vitamins and minerals in optimum amount. Most of the cases, we are taking more of calorie-dense foods or carbohydrates, and more in most of the cases, we are taking this more in the latter part of the day or the night time. That will not be metabolized enough because our body system is such that it can handle the more calorie dense foods to metabolize more in the early part of the day, that is in the morning times, but not in the latter part of the day. But with increased civilization, we are taking more energy dense foods in the dinner or in the latter part of the day, or due to our more walks in the night time, we are taking different types of the more carbohydrates and fats, and that will ultimately store within our adipose tissues, and that leads to central obesity, that leads to atherosclerosis. The border of the endothelium, that is the blood vessels walls, are coated with the lipid bubbles, and that will constrict, that will ultimately decrease the area where the blood will flow, so that there will be more work the heart has to do to keep the blood flowing to different areas of our body. So this atherosclerosis ultimately leads to increased blood pressure. So first of all, we have to cut short our daily sodium intake. Daily sodium intake should be less than 5 grams. We have to cut any extra salts, and we have to take more of the potassium. Potassium is present in different types of the fruits. So we have to take different types of the colored foods, different types of the vegetables. We have to take more of the whole grains, and we have to take more of the carbohydrates that have low glycemic index value. So glycemic index is basically the amount of the blood sugar that can be increased with a specific amount of the food. So for example, if we are taking the same amount of the white rice and the same amount of the apple, the white rice increase our blood sugar level more than the apple. So ultimately that will be more deleterious. That's why we have to choose judiciously about the low glycemic index foods. We have to take different types of the whole grains that are very beneficial. Optimum protein intake should be taken, and within the fats, we have to cut short the saturated fats. Saturated fats are detrimental for our body, and we have to take more of polyunsaturated and monounsaturated fats that will contain different types of the essential fatty acids also, and these are the good for the health. So these diets should be followed. There is a specific diet known as the dietary approach to stop hypertension, or DASH diet. DASH diet is basically amalgamation of all this. So this can prevent or curb the increase of the blood pressure. So diet is very much important. And again, we have to take the small frequent meals. We have to, we should not take more amount of the carbohydrates or saturated fatty acids at a time. And ultimately, we have to take help of the dietitian if our diet is not controlled properly. So after the physical activity and diet, the next important thing is we have to stop the tobacco. So we have to stop the smoking or any tobacco related addiction. So basically this tobacco related addiction and smoking is very much detrimental for our heart, very much detrimental for the hypertension. So this should be stopped. So about after this stopping of the smoking, then we have to reduce. Another important thing is the reduce of the stress. In our modern lifestyle, there will be different types of the anxiety disorder or depressive disorder, and this also leads to increased chances of the hypertension. So we have to decrease our stress, and in most of the cases, the hypertension cannot be perceived as such. That's why it is known as the silent killer. So if there is hypertension, if there is increase of the blood pressure for long period of time, there may be some vertigo, headache, or fatigue, or different types of the non-specific symptoms. In most of the cases, we should check our blood pressure regularly, so that it will not be high for the long period of the time. If the blood pressure is high for long period of the time, that becomes takes a toll on our heart and different other organs also. So ultimately that can lead, if the uncontrolled hypertension can lead to heart attack or myocardial infarction, there may be heart failure, there may be different other peripheral vascular problems, there may be anginal attack or chest pain, and ultimately different other end organs can also be affected. So this should not be done in case of the hypertension. So about this, for example, in case of the hypertension, after the foods, the physical activity, the smoking, the different types of the stress reduction, we have to take help of the doctors to take our medication regularly. For example, if we are taking the medication unjudiciously or without any adherence pattern, regular adherence pattern, that ultimately will not control our blood pressure level. So if your doctor will prescribe a medication, that medication should be taken as such. So adherence to medication is a very important thing, because many of the cases, if your blood pressure becomes controlled, you will stop the medication, but it should not be, because after taking the medication, if your blood pressure is within the normal level, then you have to continue the medication, and it should be changed in consultation with your doctor. So this is all about the hypertension. Thank you. Thank you very much. Namaskar.